You walk in and your patient is very clearly struggling to breathe. What are you immediately concerned about? You're dispatched to a 26-year-old female in reference to difficulty in breathing. You walk in to find her sitting in a tripod position. She's very clearly having a hard time breathing and her respirations are very fast. You obtain a set of vital signs and they're as follows. The only significant medical history she has is generalized anxiety. She states she was fine this morning and then all of a sudden couldn't breathe. She says there's a sharp pain in her side when she takes a deep breath. She also states she had some discomfort in her lower leg yesterday, but it was gone this morning, so she didn't think much of it. And the only medication she takes is Lexapro for the anxiety and birth control. So what differentials are we starting to think about? So I'm immediately thinking pulmonary embolism. Could she have possibly had a pneumothorax? Is this some kind of new asthma or maybe a panic attack? The acute onset, the birth control, the pain in the leg, and the clear lung sounds are really making a pulmonary embolism rise higher on my list. So let's talk treatment plan in part 2 of this video.